Hello there, and welcome to Lunch for the Soul, everyone. I'm Melissa Wilson in the Fox 26 newsroom in Houston, Texas. So happy to welcome you here today. I want the word to get out that there is a very special place for women in the Houston area who are having substance abuse problems. So many times people can be very concerned about the cost of how can I afford to possibly get help, so they don't. Or maybe I have a family and I don't want to leave them behind. There's no way I can take time and seek help for myself. But there's a place in Houston that wants you to know about them. They want to be available. And I have an amazing, beautiful guest today who can tell you how much it helped her. And then we're also going to talk to the medical director. So let's first of all, I want to introduce Twila. Hello,
Hi,
and welcome. I'm so happy you're here.
thank you.
So brave.
It's great to be here.
So brave to be able to talk about what you have gone through in your life and then how Santa Maria Hostel ended up helping you, as well as their eye care clinic that's part of Baylor College of Medicine. And so we're going to really get into that. I just first of all wanted to welcome you. And then I also want to welcome Dr. Alicia Kowalczyk. Hello there.
Hello.
So happy to see you. I'm talking now to the medical director of Santa Maria Hostel. Thanks for being here. Twyla, I'm going to keep you on hold for just a second while we get the
That's
doctor to
fine.
explain, first of all, what this place is in case no one has heard about it or anyone hasn't. And then we'll get deeper into your story and how it's made such an impact in your life. So why don't you talk to us, first of all, about how this came about and where and how it is in Houston?
Yeah. So Santa Maria Hostel is the largest substance use disorder treatment program for women in the state of Texas. And we're one of just a couple who allow women who are coming into treatment for residential substance use disorder treatment to bring their young children into treatment with them if they otherwise don't have a sober, safe, supportive place for them to be, which can be a real barrier to parenting women wanting to enter treatment. Over 90% of our women that come into treatment, our clients, do not have any form of healthcare coverage. They don't have private insurance, Medicaid, Medicare, so they're completely uninsured. And Santa Maria is contracted by the state of Texas to provide treatment services for folks that are under resourced, such as most of our clients at Santa Maria Hostel.
Well, and it's such a blessing because these treatment plans can cost tens of thousands of dollars, which is why a lot of women say, forget about it. I can never be helped, right? And then it just leads them to that path of never being able to steer back on in the direction that they want to.
Exactly. It's a really big need in our community. And oftentimes, as you live with a substance use disorder, you end up, losing a job if you had a job, not able to complete education, maybe losing a home or even custody of your children. And so Santa Maria is a place that you can come in literally with just yourself and what you have on you, the clothes on your back,
Mhm.
and be welcomed with open arms, saying, great, you're making a healthy decision for your life to move forward. We have a place for you here. And we're going to take care of some of those, immediate needs like shelter and food. And we
Mhm.
get donations for clothing, etc. While you get back on your feet and really get a handle on this really life threatening illness. So, substance use disorders are life threatening illnesses that are leading. One of the leading causes of death in our country now, particularly for younger folks, those 18 to 45.
Mhm.
And so it's just really important.
It is so important, and I want everyone to hear themselves from Twyla about how important it was to her. So, Twyla, let's go back in time a bit and talk about what was happening in your life that ended up leading you to this place.
I I was sick and tired of being sick and tired, but that ever you hear everybody say that, but I was, and I needed to find a way to live because I was dying and I was going to die. There wasn't a if and or but about it. I was going to die. So in the middle of the night, I called Santa Maria. I got online and looked them up, called Santa Maria, and I was here the next morning at 8 and went through the program and still going through the program. But I love everything about it. They work with you when you walk in to help you get clean. They you stay in the detox, and then you go straight in. And no one in the whole program I've been in isn't there for addiction. For
What was what was it like when you were going through this time and you wanted to seek help and you didn't know where to turn? What were your fears? I know cost is often a barrier. Did you have a family you were concerned about, or what were your other concerns?
mostly I didn't know where to go. I had no idea.
Mhm,
And I've lived in Houston my whole life. I didn't even know this was here.
mhm.
Um, and I got to looking, and Dallas had some that were so expensive, and I was like, I
Yeah.
can't do this.
Mhm.
I'm on a fixed income. I can't do this. And
Mhm.
so when I came in here, they said, just bring 7 things, and that's it. And that's what I did. And I am so thankful every day that I found this,
Yeah.
and they're willing to work with me.
And I think that's what's incredible too, is it's like you said, you keep coming back month after month. So it's not like they just said, okay, you're okay, send you on your way. I mean, there are all types of follow-up. So what did that look like? You lived there for a while?
I did. I was inpatient for 3 months,
Mhm.
and lived with uh, the one that didn't have children, which is on Jacqueline Street. And the women there were great. All the counselors, the all the med techs, everybody. They made sure that you got what you needed and it was available to you. And the teachers and the coaches. In fact, I'm going to become a sobriety coach due to their help. I mean, I learned from them that they have a heart. They know everybody's been through it. They had been through it, and you're not just talking when you talk to somebody, you know what they've gone through.
How intriguing. So now it will be full circle for you. So now you will be the one helping other people.
That's all I want to do. I don't want anyone to die from fentanyl.
And I would think that that conversation with somebody would be so real because you understand what that felt like and you understand how hard it was to overcome it, right? And so they can probably better relate to you.
Yeah, it is. It's as with anything, if you've been through it, you
Mhm,
can understand it better. But
mhm.
even when you come in, the doctors don't put you down. They don't do anything. The first words out of their mouth is, "This is a disease, and we got to fight it." Not you're a failure. You were
Mhm,
raised wrong or whatever. This
mhm.
is a disease, and I will always have it. But I'm going to fight it for the rest of my life.
No,
And
I
I'm
think,
thankful that I have
yeah.
sometime.
And I do. I wish more people would think of it that way because that's exactly what it is. There's nothing to be, we don't feel shameful if we have cancer, right? There's no need for shame and to be embarrassed to go get help. And that's why conversations like this can really open the mind, I think, of somebody who's going through a hard time of, wait a second, I have a disease, I can get help too. And everybody deserves help, whether you can afford it or not. And I think it's incredible that this is an option for people. Dr. Kowalczyk, let's talk more about what you just heard Twyla say. So,
Yeah.
how does it make you feel when you see someone like her who was really at the worst part of their life to now going full circle of feeling so recovered right now and then wanting to help others?
I mean, this is the whole reason most of us are doing this work. This makes everything worthwhile.
Mhm.
You know, if just one person can get into recovery and move forward in their life and really, get back their life, get back to living how they in their heart want to be, right? Um, and their values. It's just wonderful. And I think, Twyla really brought up about medications, and that is also something people don't know enough about. There are medications now to treat
Mhm.
some substance use disorders, like opiate use disorder. Which is killing people with all the fentanyl in our communities, like alcohol use disorder, very underused medications
Mhm.
that are used long term to help with craving control. So it's not just about willpower and fighting
Mhm.
everything yourself. If it
Mhm.
was, we'd have a lot more sober people. But
Yeah.
we really the medications make a huge difference. And we've now been able to open through partnership with Harris County, Baylor College of Medicine, my institution, and a number of donors, anonymous donors. Thank you, our anonymous donors, the Baxter Trust, the Cullen Trust for Healthcare, the Hamill Foundation, and Impact 100 Houston, a new clinic at Santa Maria where we provide primary care services, because that's a big gap in healthcare for people living with substance use disorders. They often haven't had the resources or really prioritized maybe engaging in routine healthcare and healthcare maintenance for quite a while. So they come into treatment with a lot of unmet healthcare needs. They've often had a lot of negative stigmatizing experience accessing healthcare through routine channels. And again, most of our women come in completely uninsured. So trying to, go through the process of getting qualified for Harris Health Services, for example, which is a great resource in our community, but it does take some time to kind of get those services started. We can be a bridge for that. And then we also provide long-term medication treatment for opiate and alcohol use disorder in our clinic. And now there's even some data around stimulant use disorders, so things like methamphetamine and cocaine, that there may be some medications that we can use for that as well. Again, just like with smoking or tobacco cessation that a lot of people are familiar with and may have heard, if you use nicotine replacement products, which are really medications, and or some of the prescription medications available to help you quit smoking, it doubles your chance of quitting. And we see similar data for these other medications that we have now, like buprenorphine products for opiate use disorder, naltrexone for alcohol use disorder, and yet they're way underutilized. So we're able to provide that wraparound care now for free through grant funding and our generous, donors and partners.
Well, and I think it's so important too for people to realize that this is through a partnership with Baylor College of Medicine. Can you describe that? Because I know when people hear that, it comes with esteem, it comes with an impressive group of practitioners. So how does that partnership work?
Yeah, so all of the clinical staff of the eye care clinic and at Santa Maria in our medically withdrawal unit, our detox unit, are all Baylor clinicians. So we have primary care clinicians, both MDs and a nurse practitioner, and then that's one of our nurse practitioners, Kelly Bush, and then two addiction medicine boarded clinicians. Myself, I'm both addiction and family medicine boarded, and Dr. Furo, who is new to us this year, and she's addiction medicine boarded as well. And so I think the other point of the eye care clinic is, again, I stands for integrated care. We provide integrated care so people can get their primary health care needs met along with their behavioral health care needs, such as their substance use disorder. And it really drives home the point that substance use disorders are medical illnesses, just like diabetes, just like high blood pressure, and they're chronic illnesses. And so they require a chronic disease management approach. So we're really hoping to get that across and just be a welcoming space for people to start, restart their healthcare journey as they enter recovery.
And what a powerful name of your clinic too, the integrated care and eye care, and it's making you feel somebody else cares for you and your life and your situation. I just feel like it's so enveloping of somebody who's going through a tough time. I want to bring Twila back in because Twila, we didn't talk a whole lot about medications. Were you able to do some things like that to really help so that you didn't just have to go cold turkey and out on your own? How did that make a difference in your recovery?
Oh, it was unbelievable because I had, with what I was on, my DOC was, I'd always get sick or whatever. When I went in there, they worked daily with you to find your combination.
Oh,
and then they'll tweak it, as you go. But I found mine very quickly, and I literally don't have I didn't have the withdrawals. And it's just learning how to live being a recovering addict. And not many people know that, but you have to, if you can really get to the problem where you're not worried about your physical and you can worry about your mental, then they do everything. They do the mental, they do the physical, and they teach you how to live a clean and sober life.
I don't think that many people know that you can go through this with that much support. I think that people are so scared of those serious withdrawal symptoms. So you really didn't have any of that seriousness that everybody fears or that we see in the movie?
I did not. They only had to change one of my medicines, and it was a sleeping medicine. But all of them are the medicines that they give me for mine are very hard. They're expensive, and they, I come every month here, probably twice a month, but they always find what works, what blends, what works, and that's your drugs. And it's not even, to me, it's a salvation. It's like taking insulin every day if I was a diabetic. And
it's powerful to hear that from you. Yeah, and Dr. Kowalczyk, my hope would be that word gets out through messages like this, that it doesn't have to be that scary. Let's talk about what somebody has to do to qualify. So if we have somebody watching right now and it's a local mom who's just yearning to reach out to you, do they first go through an application process, or how does that begin?
So again, for our detox services, they can just walk in Monday through Friday before about 11 o'clock. So we can get them assessed and get their medications ordered and get them in. They can call our facility and get patched through to our admissions department if they'd like to schedule an actual appointment. And there they have a form online that is very short for them to fill out, just a screening form so that we can anticipate their needs. And, there are certain criteria in terms of getting the funding, but they will work through that with the person. We just want you to reach out and come and get the help that you need.
And it sounds like it just is truly a lifesaver for people if they're able to go from just severe addiction and all the drama that goes along with that to turning their lives around and wanting to become a life coach and help and make a difference. That's a big turnaround.
And we do cover the cost of the medications that we write for in the eye care clinic. So we have a couple state-funded programs for the medications for opiate and alcohol use disorder, very specifically. And then again, through generous donors and grant funding secured through Harris County and also through Baylor College of Medicine and some congressional funding through that, through Representative Garcia. We're able to cover the cost of those medications. So that's not a burden or a barrier to patients getting and staying on treatment. And I do want to echo, again, what Twila shared. So many times at the end of a patient's detox day, they'll tell me, if I'd have known I didn't have to be so sick and I wouldn't feel miserable through it, that I've been taken care of, I would have been here a lot sooner. And again, what you see in the movies and TV shows and stuff, it's dramatic and it's for drama, but now we have good medications that most people can be, you may not be 100% comfortable, but you're not going to be, feeling horrible while you're with us. And we're going to quickly work to make sure you're feeling good.
Twila, is that one of the reasons that you might have waited longer, because you didn't know that help would be quote unquote that easy? I mean, I'm sure it wasn't a piece of cake, but a lot easier than you ever thought it could be.
Oh yeah. And I was scared of withdrawing. And when they said detox, I was like, okay, I'm going to be in the corner. But I slept, and they feed you a real balanced meal. They work on your medications daily. You see a doctor daily when you're in detox, and they follow you, make sure that you're doing all right. And they take your blood pressure, they watch you, and the nurses in detox are angels. You don't want to leave. They're like, they wait on you hand and foot. They make sure that everything is well. And get you started on your road to recovery.
Yeah, there are special people in this world, our angels on earth, that I really think they were just meant to do that job, right? And
Yeah,
making
they
such a
were.
difference in your life. And I feel the love in your voice and I see it in your eyes. And I hope they're able to see that and be able to reflect how they were able to help you and now how you're going to return that favor. Doctor, I just wanted to talk to you just a little bit more as we wrap up
Mhm.
today, just to make sure that everybody out there understands what you can offer. So would it be for somebody who just had alcohol abuse or just drug abuse or just prescription drug use? Is it a wide array of problems that you can treat versus one or the other?
Yes, so at Santa Maria, we offer full services for substance use disorders across the board. Most people are using these days in this day and age more than
Hmm.
one substance at a time.
Hmm.
Polysubstance use is the norm.
Hmm.
Really, just come if you're using substances, you're worried about having a substance use disorder, it's causing problems in your life, drama, you want to make a change. That's when you should reach out to us.
Hmm.
There are other addictive disorders, so process addictions like sex addiction, gambling addiction, things like that. We're more geared to substance use disorder, so you do need to have a qualifying substance use disorder for admission.
Hmm.
But short of that, we are, pretty much any substance. We've seen it all. We've
Yeah.
we've helped folks through it all. So.
That's important for people to realize too. You will not be the first for
Yep.
a number of reasons.
Yeah.
Twyla, as we wrap up today, what would you say to encourage somebody who's just right here on the edge of their seat and they want to reach out, they want to get help, but it's just very difficult for them right now to take that next step? What would you say?
If I can do it, you can do it. Anybody. I mean, it's one move, and if you take the first step, they're going to be there with you for all your other steps and teach you how to walk that road, the
Mhm.
new road. And my life has changed 100%, and I wouldn't have it any other way.
Again, as we wrap up, Dr. Kowalczyk, will you remind everybody how they can find you?
Yes, so you can reach out to Santa Maria Hostel. We're on the web, santamariahostel.org, or phone number 713-691-0900, 713-691-0900.
All right. Well, thank you, ladies, so much for being here and talking about this and sharing this. And we'll do what we can to spread this important message. And I hope that more people than ever will get the help they deserve. Really did get a new lease on life. It'd be a beautiful thing to witness. Thank you.
Thank
Thank
you.
you.
All right. And thank all of you at home for joining us. I always love having you here with me on Lunch for the Soul. Just a reminder, if you joined us late, you can always find Lunch for the Soul in a lot of places. You can, first of all, stream us on your TV. You don't have to do a computer or cell phone. You can go to our Fox Local app, free on all your smart TVs. Maybe you have a Fire Stick or a Roku. You can easily find all the Lunch for the Soul episodes there. You can also find us on our Fox 26 YouTube, Fox 26 Facebook, last but not least on our Fox 26 website, fox26houston.com. If you have any ideas, you're always welcome to reach out to me. I would love to hear from you because that's how I find my ideas. When a lot of times when you reach out and say, you know what do you think about this? And I'd love to say hi and feature you right here on Lunch for the Soul. I hope you have a beautiful day, and I hope to see you back here next week. Same time every week, Wednesdays and Saturdays at 12:30. Bye-bye.